Hi everyone. I'm putting together another video to kind of give everybody an update on where I am medically, what's happening with me medically, and kind of some of the stuff that's been going on with me. In my other videos, I talked about my medical stuff at the end. I'm going to do it at the beginning now. So if you were skipping ahead to the end, you don't have to worry about that. So I received my targeted treatment for the 2 tumors in my liver, um, and um, that was what I described the last video, where they went through my artery and they had to do the mapping, and it was a bunch of little radioactive glass beads. And then I had the follow-up scan, and unfortunately it showed that my cancer had progressed further. There was a couple of more spots in my liver, and then the mystery spot up in my heart and lungs um, was confirmed to be cancer and tumors and all that good stuff. Um, so basically, the systemic treatment changed. So that means that I started a new chemo. So I started this new chemo probably about 3 weeks ago. I'm going on to being on it for just about a month now, and it's excuse me, it's less well tolerated than my other chemo. So I've been having the fun experience of waking up in the mornings and throwing up and waking up from feeling like crap. All these things, which um, are all being managed. Like, I'm not throwing up in the mornings anymore or anything. I've talked to my doctor, and we're dealing with the side effects, which is always a fun new process. Starting any new treatment is going, oh, all right, what are the side effects this time? How are they going to happen? And then also, over the course of time, as new side effects pop up, it's always a fun game dealing with them. Yeah, so that's been kind of what's going on with me. I guess the good news with that, the chemo change has been that it's a different chemo than I was supposed to go on. I had a chemo that I got my port for. It was an IV chemo, so they give you a port in your chest, and so I was supposed to go on that one, which is a little bit more serious. They use it for there's like a progression to treatments, and so they use it for treatments that have, or excuse me, tumors that have already been heavily treated. And so they're trying out this chemo before that one just to see if it works. So once again, I'm happy with more treatments, buying me more time. It's kind of the best worst case scenario, which is good. I'm happy with that. And yeah, and so I'm kind of doing my day to day dealing with side effects and life. And it's been a little odd for me, actually, that I've been kind of putting off this video for a while, couple weeks at least, and I thought that it was appropriate. This month is National Suicide Awareness Month, and today is National Suicide Prevention Day. So, I mean, one of the reasons why I kind of put this video off was, I had been doing lacrosse. I'd been doing lacrosse. I got these targeted treatments that knocked me on my ass for about a week or so with the radiation and everything like that. A little bit longer than that maybe. And then at the end of it, I was kind of in this waiting game of like, all right, seeing if this treatment's gonna work or whatever. And had kind of one of those like, now what moments, right? So I have been going through a lot of transitions, in terms of my first video talks about, deciding to not continue with my academic and professional career. Right, so kind of taking those things out of my my life, my identity, my whatever, and then I have lacrosse to kind of distract me from the next step or whatever, or that was the next step, I guess. And then that ended, but I had the treatments to kind of distract myself, and then the treatments ended, and I kind of got into this now what, and that kind of did bring me down into a funk, brought me down into a depression, and for those that don't know me and don't know my stories, that I've dealt with depression most of my life, at least for most of my memory, and suicidal ideation, depression, suicide have been a part of my life for a long time, and I can really appreciate. I really like dark humor. I really like irony, and I really appreciate that. Over the course of my life, most of my life was spent wanting to die, and then, of years of, working on myself, going to therapy, doing a lot of introspection, doing a lot of gradual change. Anybody who's gone to therapy, who's dealt with mental health issues, addiction, depression, anxiety, bipolar, whatever it is, they know that change, positive change and improvements, are incremental, right? It's like the seconds on a clock, right? They build up to minutes and hours and days and weeks. So over years of doing that work and really struggling, I got to a point where I didn't want to die. So the irony isn't lost on me that so much of my life I wanted to die, and then don't want to die anymore, and then I get struck with a terminal illness. So I can really take the time to step back and laugh at it. Like I said, I really appreciate dark humor and irony, so it's funny to me. So I, kind of this depression is always something that I deal with, right? It never goes away. My relationship with it changes. Some days are better than others, obviously, and some days are worse than others, right? It's about this relationship that I have with my depression, with myself. And honestly, the work that I did with, on myself with my depression, learning to get a better relationship with myself, to better understand myself, how I, treated myself on a lot of different levels. The things that I wanted and didn't need, all these things, this work that I did that brought myself, that kind of brought me back to this place of being healthy, being in the land of the living, loving myself, right? Not just tolerating myself, but really loving myself and knowing what that meant and the work that I had to do to put into that. Right? It's just like a relationship with anything else. You have a relationship with a partner. You can say I love you all you want, but if you're not going and doing the things that nurture that relationship, it's gonna fail. It's gonna crumble. So that's what I had to do with the relationship that I had with myself. I really had to nurture myself, listen to my wants and needs, really get to know myself. And so over the course of doing that, I got healthier with my mindset, healthier with my emotions, um, getting to a better relationship with my depression. I never say that I overcame my depression or that I don't have it or whatever. I frame it with that relationship that I'm having. Some days it's, I'm struggling with my depression. Some days it's I'm living with my depression. Some days it's, um, you know, um, whatever the relationship is. And over the course of doing that work, it's really allowed me to shore up my foundations as a person, to really get to know who I am in my bones, and this diagnosis has kind of put that to the test, has really put that to the test. Even still, there's a lot of days that are, really difficult, and it'd be so much easier just to give up. And there's a reason why some of the biggest population that commit suicide are people with chronic illnesses. Along with LGBTQ people, along with children, young men and women. And I think a lot of it, the metaphor that I have been using recently is like drip water torture, right? Where you're strapped on a table and there's just a drop of water dropping on your forehead, and there's nothing that you can do about it. And eventually, it breaks you, it drives you crazy. It's torture, right? And yeah, having a chronic illness is very, very much like that, right? A few months ago, I was able to work out and go for runs and be in good shape and all of these things. And now I'm out of breath walking my dog. The shorter walks that we used to do, thinking, oh God, do I have to take a minute to lay in this person's front yard to catch my breath, to collect myself. It hasn't come to that quite yet. If it does, it does, but it hasn't come quite to it yet. Seeing these things, and kind of seeing the progression and knowing that, I do what I can do every day. But, that's also kind of how these things go. And it's really difficult. And I've had a lot of people, comment to me like, oh, I don't know what I would do if I was in your shoes, and I don't know how I'd react, and you're reacting so much, better. And cancer is a little bit weird in terms of there's almost nothing correct to say to somebody with cancer. It all kind of misses the mark. And that's definitely one of those things. I would recommend doing some research on empathetic responses and empathetic ways to discuss things with cancer patients. But I don't know what I would do if in your position thing, at least for me, kind of rubs me the wrong way, because in some ways, it's either putting me on a pedestal or pitying me. Neither of those are things that I want. And in terms of, not that, people say like, I don't know how I'd react in that situation, right? Of course, nobody knows how they would react in a situation unless they're in that situation. But oh, you're so strong, you're so brave, I would be breaking down, blah 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 blah, all that stuff. It either, like I said, it's either, kind of putting me on a pedestal or pitying me, or taking away from that person, right? I'm always amazed by just the strength that people have in extraordinary circumstances, regardless of what those are. But I think that, like I said, the work that I have done on my own mental health and getting to a healthy place within myself, and all of the skills that I developed for that, all of the skills that I rely on, some of which have to change now too. A lot of my coping mechanisms were, working out, physical activity, and for a lot of that I can't do that anymore. So now it's, kind of shifting to other things. And I think that, I think that this shift, that this hard examination that, I've been really forced to do, getting this diagnosis, is something that, we've kind of collectively experienced within the last couple of years. 2020 was a hell of a year. We were forced to be inside. We were forced to be with ourselves. We were forced to be in extremely uncomfortable situations. And, those uncomfortable situations are where, like, the magnifying glasses come out, right? You see how you relate to one another. You see how you relate with your family and the people that mean the most to you. You see how you relate to yourselves, and, the toll that those extreme circumstances can have on people. You saw it with relapses increasing, overdoses increasing. I lost my brother at the beginning of 2020, a little bit before kind of the pandemic happened and the pandemic exploded. And since then, it's been nonstop. You look up the numbers, it's been astronomical, the amount of people who've died from overdoses within the last couple of years. Suicide is up. All of these things, people being diagnosed with mental illnesses, especially the, young kids and young adults. I think that it's a little bit easier for older generations to kind of become jaded to what it's like growing up in this climate. The world is ending. Hurricanes, wildfires, earthquakes, all of these things, and we're expecting kids to go to school like it's normal. Go to school where it's normal, where, they have to walk through metal detectors so that, they stop the next mass shooting, where they have to wear masks because there's a deadly virus. And, and it's just so unimaginable that we're asking those kids to just go and continue like everything's normal. And we're having to do it ourselves, so we get put in these extreme circumstances. And, it really illustrates how strong our foundation is, where the cracks are. And I think that every foundation has cracks. Whether it's a you know a castle or just a regular old house or whatever it is. Um, Whoever you are, there's cracks, and COVID really illustrated that, and we saw a lot of different ways to cope with that, right? Um, like I said, suicide, overdoses, um, people relapsing, all these things, and also people joked about binge shopping, right? I'm the worst. It is absolutely one of my coping skills. Um, Binge shopping and overeating, right? Everybody talks about the poundage that they put on for COVID. Um, all of these things, right? Watching every single show on Netflix, Hulu, Disney Plus, and HBO Go. Something I'm also guilty of, right? It's, we see how we cope when we see what we do, and we see how these things are a distraction, from a situation, a real situation that needs to be addressed, or are healthy coping skills, right? Sometimes it's hard to tell the difference, and sometimes they kind of morph and are fluid with one another. But it's something that it's an important process, I think, being put in these tough situations. um, kind of testing your mettle, so to speak. um, because if you succeed, you succeed, and if you fail, uh, that's where you rebuild from. That's how you um, strengthen that foundation, right? You do like a pressure test, and where the cracks happen, you focus and you work on it. And if you see those cracks and you disregard them, then it's going to get bigger and bigger. Um, and I think that's where it's important, to really focus on those other supports that we have, those things that kind of give us strength. I was talking to a good friend of mine today, actually, and she was talking about, how it's so overwhelming to think about everything that's going on right now. Like I said, climate change, the world's ending. Climate change and COVID and the economy and, Afghanistan and, abortion and voting and all of these things. And that's really just us focusing on our little country here. And it's so easy to be overwhelmed and to kind of get stuck in that. And that's just the environment that we're in, let alone our personal lives, right? Let alone relationships, let alone illnesses, let alone the unexpected financial burden of a car breaking down, or any of these things, or whatever. And she was kind of talking to me about this, and some experiences that she was having recently, and it brought her back to the relationships that we have with one another here and now, because that is ultimately all we have, right? Is the here and now. for me, there's a lot of really good times in my past that I remember things that I can't do anymore. Everybody has this. Everybody has this, And unfortunately for me, it's a little bit more acute because the remainder of my time is going to be more downhill quicker than for most people. And that's the future that I'm looking at. And neither one of them seems too great. But then I'm come back to where I am, and I express all the gratitude that I have. I have a wonderful family, and I'm lucky enough and privileged enough that they can support me and take care of me, and I have a house, and I don't have to worry about my needs, right? That is something that I'm incredibly grateful for and privileged to have and lucky to have. And I come back to that place, and I look around my room, and even though I can't really hang out with people and see friends, I have my dog, right? Every time she walks in the room, she just looks at me, and I'm like, oh my God, I love you so much. I have my parents, as much as they annoy me all the time. I have my parents, and I have my, my other brother and his girlfriend, and friends that I connect with over the phone, and and the rare few people I do get to hang out with face to face, ensuring that we're all safe and vaccinated and everything like that. As my friend was saying today, it's about those relationships, and those relationships are the only thing that we have right now. So when those cracks in the foundation get too big to ignore, or too big to support us, right? When our foundation breaks and our house falls, it's those supports, right? Those relationships that we have in the here and now, and reaching out to one another and the people that understand us and the people that get us, and that that connection. And I think I'm going to say one more quick thing about this is that cancer is really isolating. And I think that it's because it's such a big experience to try and empathize with, right? Somebody can empathize with, losing, losing a job, or getting an illness, or feeling like shit, or not having physical capabilities where they were, or all of these kind of little components. But when you kind of add it up and look at it as a whole, that like, I'm not going to have a job anymore, and I'm not going to have a family of my own, regardless of whether or not I want kids, right? Like, that choice is taken from me. And I think that it's that choice that's everything, right? I'm not going to have, a long-lasting, intimate relationship. I'm not going to, see my dog, grow old. I'm not going to, all of these things. And that's something that's really hard for people to empathize with because it's so much, it's so big. And I've experienced it myself where I don't even want to talk to people about what's going on with me because they just don't get it. They just don't understand, and everything that they say falls flat, like I said. And some days you don't want to have to find it in yourself to go, I know that this person's coming from a good place, and that I shouldn't, dismiss what they're saying just because it falls flat. To me, I know that that they're doing the best that they can with what's happening. And some days you just don't want to deal with that. And so I really do my best to create an environment for myself that allows people to respond to me in a way that I can accept, and that I can feel the empathy and can feel that person is trying. I've had a lot of conversations with my friends, my parents, my family members, being like, hey, like, this thing that you said could be said in a different way, or this, trying to create that atmosphere so that I can talk to people, and have people understand. And also I reach out to, I use cancer support groups. I go to pretty regularly a young adult cancer support group. I get to connect with absolute strangers on such a deep level because we can actually empathize with that large experience. We can really, understand what somebody's going through as much as, anybody can. Even though we're total strangers, right? I've never met these people, some of them I only see once. Some of them, like myself, are, come back to these groups and we can kind of build up a rapport, but, I don't know them at all. And yet, in a lot of ways, they feel closer to me than, a lot of my friends and family, because there isn't that isolation, I guess. I got an Instagram just to have access to a few young adult cancer meme pages, which I think is incredible, and if anybody, memes are kind of like a universal language almost. You look at a meme and you go, I know what they're getting across there. So there's, I believe it's called The Cancer Patient, is a great Instagram account. I encourage all of you guys to look at it and follow, and maybe you can kind of get a glimpse of, living that cancer patient life. The little icon is it's a yellow smiley face that looks like it's holding its breath. Fun fact, if you're ever in a CAT scan or an MRI machine, some of them have that logo, and it's the logo for when you have to hold your breath getting scanned. They go, hold your breath. And they show that little logo, and then they have a little exhaling one. So yeah, it's a little logo that's holding its breath, and its name is The Cancer Patient. It's a really good Instagram account. But all of these things are, like I said, me trying to kind of create an environment for myself that I can have those supports, and I don't have to be isolated, because, so much of what we go through is isolating. I don't know what it's like to be a victim of a sexual assault. And that is an incredibly isolating event. I don't know what it's like to be a person of a different color, um, living in America, which I'm sure is incredibly isolating, even though it's still, even though there's so many other people living that experience. Um, all of these different things, we only know our own experience, right? And for a lot of ways, that can be incredibly isolating. I, didn't talk to my, didn't talk about anybody about my depression or my, uh, anything dealing with suicide, for a really long time because I was ashamed of it, right? I had this, this idea, and I think that one of the things about depression is that it's kind of, it's a liar, right? It's one of those things that, kind of whispers in your ear, oh, people don't want to hear about that anyway. You're not worth it enough for them to even bother with. So why would you tell them what's going on with you? You know, you're not worth anything. So why concern others? And it's really dangerous in that way, and is really isolating in that way, and can be a really dangerous trap. Not something that I've experienced. And once again, the skills that I learned dealing with my depression and my suicidal ideation, things that I still deal with, to this day, helped me get to a point where my foundation didn't totally fall apart under this, crazy life-altering news and circumstances I find myself in now. I'm as challenging and as hard as all of those years were, and living with the internal experience that comes along with depression, and is grueling, is every day, right? the Chinese water torture. It's exactly what it's like, and and it's something that we don't have to go through alone. So I just wanted to kind of take this time here today to kind of talk about that and kind of relate, my past experience with what's going on with me currently, and hopefully, some of the things that I talked about, resonate with you. And if you are out there and you are hurting, whatever that is, whatever circumstances it may be, whatever that pain is, I hope that this touched you in some way, and provided some encouragement to get support, or to treat yourself kindly one day. All of these different things. With that being said, please, if you are struggling with any of depression, suicide, any mental health issues, please reach out for help. There's professionals for a reason. There's a lot of good practitioners out there, and if you find that right one, it can make a whole world of difference. If you're currently, struggling, call 911. But if you need somebody to talk, the suicide prevention hotline is 800-273-TALK. So that's 800-273-8255. Once again, 800-273-TALK. Thank you for joining me today, and letting me kind of share a little bit about my experience with you all. Until next time, have a good one. Mitakuye Oyasin.